Through incredible perseverance and determination, the Katherine West Coordinated Care Trial grew into what is now the Katherine West Health Board. It is a model of real engagement with the people in the region, and most importantly, it is providing real gains in health outcomes for the area. For those involved with the project, then and now, there is a real sense of achievement and sense of pride. There is a lot of hard work behind the scenes too, keeping the organisation working at a high level and making sure outcomes are achieved in all areas.
I think the origins of the health board, the excitement of that, I think we're still true to that excitement, because if you're really making a difference in Aboriginal health and you've really got sincere engagement with Aboriginal people, you'll have a dynamic process. And the key is keeping the dynamism happening all the time, and that is the responsiveness, the relationship, what's going on at the grassroots level. Work really hard at that, and almost on the surface of it you say, on the surface it looks like we're just getting good outcomes, but what's not seen is like the duck underwater, paddling furiously, working really hard at keeping the grassroots communication alive in the organisation.
Good morning.
How you doing?
We have to remember that the Katherine West Health Board plays a vital role in making sure that the needs of each community are met.
Katherine West Health Board is about having a relationship with our communities, so ensuring that our community people can have input into design and the style of health service delivery that works for them. Not something that works best for non-Aboriginal people, but how that service delivery works best for Aboriginal people in remote communities.
No matter where you work in the Aboriginal sector, to do with communities, there's a lot of talk about community engagement. There's a lot of talk about community development. There's a lot of talk getting things right, and there's always a lot of us white fellas around with a really good idea, but none of them have really been tested, or we think they're tested. We'll go and talk to Aboriginal people and say, this is what I want to do, and quite often Aboriginal people in the communities suffer a lot of white fella burnout of having to listen to ideas and grant applications and submissions. And I think the excitement of the Katherine West vision, the Jindagumita vision, is that it has to be real engagement because they're actually the board. They're doing the employing, they're doing the hiring and firing, they're running the community meetings. And at our board level, they'll say, well, if we don't understand it, we've got to talk more about this. And we have some really good Aboriginal staff who make sure that's happened. So it's a really different model. Sometimes people don't understand why we take so long to do things, but we really make sure that, our clients and our consultants in the communities really do understand what's going on, and the board makes sure that that happens.
Katherine West Health Board has a short history, but as time passes, it is evident that providing a health system based on what people need in communities is working. And with the strength and perseverance of all of those involved, it is likely that the story of Katherine West Health Board has just begun.
I think people had got to that point where, nothing's working, but, let us try and control some of this and see if it works. And look, 10 years down the track, it certainly has worked and has shown that if you build the structures right, if you talk to people, if you include them, if you give them that control, great things can happen.